With me today is Dr.A Muruganathan. Sir is currently Dean Indian College of Physicians. Sir is also Governor-elect for American College of Physicians. Sir was immediate past President for Hypertension Society of India as well as past President for API,
Yes.
Physicians Indian biggest body. So today you were touching base on hypertension disease and how do we manage it. I just wanted to understand how important is home blood pressure monitoring in the current management of hypertension, sir?
Very good question. In India, there are about 10 crores of people having hypertension. Another 10 crores are in the pre-hypertension. But unfortunately, the home blood pressure monitoring is not popular in India. Home blood sugar monitoring is at least to a certain extent popular. In those days when we had home blood pressure monitoring, people were saying the blood pressure monitor does not take good reading. But now a lot of newer monitors have come, very good. If somebody takes home blood pressure monitoring in a home, the adherence to the treatment is good, the control of blood pressure is good, and one BP monitor can measure the BP of the whole family neighborhood also.
True.
So the doctors also, when they see the patient with the previous records, they will come to know whether there is any BP variability, whether BP fluctuation, whether the drug is acting, whether they require nighttime drug. So all these benefits are there when the patients start using home blood pressure monitoring.
How reliable are these currently available instruments in market, sir?
Actually, if you go to the website, there are internationally approved home blood pressure monitors which are available. You can buy them, and for the safety and the surety, you can ask your family doctor or a physician and take the BP monitor and check the BP and compare the BP with the doctor's BP monitor.
Okay.
So that you'll have an idea.
So the standardization can be done based on your doctor's
Yes.
instrument, so that you have an idea of
Yes.
is it the same or there is some difference which is there.
The advantage of again home BP monitor is in the hospital you may have white coat hypertension.
True, very true.
In the house environment, that is not there. Even the masked hypertension, people with pre-hypertension, we can diagnose with home BP monitor, and BP variability also can be diagnosed. I give a small example. I gave it to one of the grocery store in Tirupur. That person has learned the BP monitor, and he is a BP patient now under control. He not only takes BP for his family, people who come for purchasing grocery, he takes BP. So more people come to him, and he started checking and giving them that reading also. So it's very useful.
Very true, very true. So now India as a country is moving away from infections and non-communicable diseases burden like hypertension, diabetes, atherosclerosis is on a sudden rise. So how do we tackle this growing menace of these disorders, sir?
You are very right. The economic burden of the country also is affected because of the NCDs. Before we used to talk about infection, tuberculosis, things like that. Now, as you rightly said, cancer, diabetes, hypertension, obesity, high lipids, all play a major role in people's health. See, suppose somebody is not well, they don't come for the work. It is a waste or a burden for the country. So we call it as disability in days. So in that way, huge loss for the country. But controlling these NCDs or treating the NCDs will definitely prevent this economic loss.
True.
The best example how generally we can do is we can promote lifestyle modification. By promoting lifestyle modification, you can control all the NCDs. See, for example, everyone has got a role in lifestyle modification. Individual should do, definitely. He has to do the lifestyle modification. The corporation, the municipality also has a role, because in every street, if you have a nice park for walking, if you have a nice place to go, then only people will be motivated to go. See, for example, in one of the Western countries, there is an elevator going up. Everybody goes in the elevator only. They don't use the staircase. What they did in the staircase, they put a nice music. Every step there is a music. So people enjoy that, they walk. And instead of going by lift, you should always go by stairs. And all the religions, Hindu or Muslim or Christian, when you go to church or mosque or temple, you go by walk. But now we do go up to the entrance. And then Another thing which we should not do is taking food in front of the television, because we don't know what we are taking. Right. That is why I always say this is not lifestyle modification, it is lifestyle modification, because the wife in the house, only cooks, she knows what to cook, so she must add more vegetables. Every Indian, every person should take 4 times vegetables or fruits. We don't do that. We do take fast food. Fast food takes faster to the grave. And then wife again makes your family, children and husband to walk, and she also thinks about all the positive for the physical activity. So she will not allow you to eat in front of the television, and she will also come with you for walking. And these are the lifestyle modification which we can do every day, not one day. This is the first step in prevention of any disease.
Sure.
Then only drugs come.
So I think that's a very important message which you are trying to give, is that lifestyle modification, improving the quality of food we have, more of vegetables and fruits in the diet, and physical activity, these should be taken care of. Coming to the drugs, sir, so which are the preferred class of agent if patient has to be on antihypertensive medication? Which will be your preferred choice of first line agents?
Actually, those days we used to call this step care therapy, step 1, step 2.
Right.
Now, this sequencing of drugs depends on age, depends on the associated risk factors, depends on associated disease, depends on what other drugs you are taking. I'll give you an example. If the patient is young, it is high renin. So high renin group, we can give ACE inhibitor and beta blocker. In an older age, low renin, they may be given calcium channel blocker and diuretic. Suppose if the patient has got associated disease like diabetes, ACE inhibitor is the best.
True.
If the patient has got associated disease like asthma, we cannot give beta blocker. If the patient is obesity, then beta blocker cannot be given, ACE inhibitor can be given. If the patient has taking non-steroidal anti-inflammatory drugs or some other associated drugs which increase the blood pressure, the best drug is calcium channel blocker. Even ACE inhibitor may not be good. If there are blacks, ACE inhibitor will not work, so you have to have diuretic. So like that, it depends on the age, it depends on the condition, depends on the risk factors. That's how we prefer. But in general, we call it as A, B, C, D. For young, it is A and B. A is ACE inhibitor, ARB. B is beta blocker. For old, C and D, calcium channel blocker and diuretic. And again, if it is with complications, depending on that, suppose somebody has got cardiovascular problem, best drug is beta blocker. Like that, we classify according to the
So
need.
the therapy need to be individualized based
Yes.
on the patient age and based on the patient comorbid condition.
Yes, that's right.
And all the agents are useful depending on the patient scenario. So A, B, C, D, all the 4 could be used in the patient respectively based on their age and the presenting comorbid condition.
General dictum, beta blocker and diuretic may be avoided, because if it is really compelling indication, you would give. Otherwise, beta blocker and diuretic, in chance of persons developing diabetes is more.
Okay.
So we avoid. Similarly, ACE and ARB together to be avoided.
Okay.
And ACE and ARB not to be given in pregnancy.
Okay.
Like that, there are certain don'ts.
Correct. So what are the 3 key messages you will like to give to physicians who are managing a large number of hypertensive patients in their practice? So what are the 3 key takeaway messages for the physicians?
The first message is the blood pressure measurement, the physicians must at least do by themselves, because many a time the reading itself is wrong.
Correct.
And there is now, of course, the basic thing, the technique should be followed. And then they must also talk to the patient, educate them what is blood pressure, what is the target they want to achieve, what is the threshold they have to do. All that, must explain. And then there should not be any inertia. See, for example, somebody comes with high BP, they must be ready to switch over the drug or change the drug or add the drug.
Correct.
Clinician inertia is one problem of not controlling the blood pressure.
True.
That is number 2. Number 3, always advise them about lifestyle modification and then salt restricted diet, for example, and tell them whenever they go and buy something, they should see the food label, what is the salt content, what is the fat content. So this sort of awareness they should create.
Correct.
And if they have periodically, they should check their blood cholesterol, sugar, so that we can control comprehensively as a patient, not only treating the numbers. Treating the numbers is not enough. You have to treat the patient as a comprehensive. If they smoke, smoking cessation is very important. Alcohol, you must advise not to. Like that, comprehensively if you approach, that will be the best treatment, not by just measuring and controlling the target alone.
Correct.
Is not enough.
So just blood pressure alone is not to be managed, but the patient as a wholesome has to be managed along with other associated conditions.
With education.
With
education is very important. Now,
Patient education.
patient education is very important, and doctors should take some time to explain.
What are the 3 key messages you will like to give to the physicians who see large number of hypertensive patients in their practice, sir?
The first and foremost, in my opinion, physicians themselves should take the blood pressure, because sometimes when the nurses or the paramedical check the pressure, it may be wrong because of the technique. So the basic technique should be followed. So physicians should take the blood pressure, and then they also should validate their blood pressure monitors. And then they must talk to the patients, educate them, because the first treatment is the patient education.
True.
And one of the things is, the doctors also must advise home blood pressure monitoring. Just like home blood sugar monitoring, home blood pressure monitoring is not popular.
Correct.
I always tell people, there is a Chinese proverb: tell me, I may forget; show me, I may remember; but involve me, I'll understand. So you must involve the patients in the treatment. That thereby adherence and then control will be better.
Correct.
The second thing is, they should also speak to the patients and patient attenders, especially if the patient comes, you should talk to the attenders also, how the lifestyle modification is important. Because lifestyle modification, for example, salt restriction, we talk so much, but they will take some puppets, uppets, pickles, which contain salt. Without their knowledge, they take. So ask them to be aware, and when they buy some food, they must see the food content. So lifestyle exercise they should advise. I always say, as I said, you will have to talk to the family as a whole, what diet they should take, and then 4 times vegetables, and small simple things they should tell them. The third, the physician's inertia, they say, when somebody comes with high blood pressure, when the systolic blood pressure is more than 20 and diastolic is more than 10, you should never hesitate to start them on 2 drugs, combination therapy.
Right.
Because normally we say, next time we'll see, but then by the time next time they come, it may be target organ damage, and there will be problem also. So clinical inertia should be avoided, and if the one drug is given, you can try the switch over the other drug. Make sure they get the target. When I say target, you must also see as a patient whole. Only reducing the numbers is not our aim. If the patient has got associated risk factors, smoking, ask them to stop smoking, alcohol to be reduced, weight should be reduced. If the weight is not ideal weight, at least 10% of the weight if they reduce, blood pressure or the communicable disease may be controlled. So overall, a comprehensive treatment for a patient is required, with patient education, with proper follow-up. Nowadays we have mobile apps, so you can send mobile information also, make them come for frequent checkup, right, and then advise them to follow regularly, and then we can control the blood pressure. And as I said, it is not only the doctors, the whole community also should cooperate. Wherever there is community centers, we can check the blood pressure, like airport, festivals, railway stations, so that whenever you are free, you can check the pressure, so that you know the pressure.
To summarize, 3 key takeaway messages will be: one is patient education, involvement of patients in their own management.
Correct.
Monitoring of the blood pressure by the physician themselves.
Yes.
And last but not the least is not to have the physician's inertia,
yes,
in maintaining the patients with drugs whenever required to bring them to the control level.
Yes.
So thank you, sir. Thanks a lot for joining us. Thanks for sharing your views.
Very good question. In India, there are about 10 crores of people having hypertension. Another 10 crores are in the pre-hypertension.